And this is actually a retrospective review looking at patients with primary refractory diffuse large cell lymphoma. So in practice, it's very difficult to know whether to take primary refractory diffuse large cell lymphoma patients onto transplant. So this was a large retrospective review looking at the refined database, looking at 15 centers in the U.S., and they took patients with diffuse large cell lymphoma who were either primary progressive disease, residual disease, or early relapse. And they looked at those patients, and those patients who responded to treatment went on to a stem cell transplant. And they looked at overall progression-free survival and survival in those patients and identified risk factors which could help us determine which patients should receive a transplant and which patients really should go on to more experimental treatment. So the study identified three main risk factors that we should be looking at in these patients. That was primarily progressive disease, whether they were c-MYC positive or whether they had a high or intermediate high IPI. So I think the real importance of this study is that if you don't actually have any of those features, even if you have primarily progressive diffuse large cell lymphoma, you do actually do fairly well with a transplant. However, if you have all three of those or two or three of those features, then you don't do very well with treatment, and survival was only 10% with high-dose therapy. So I think it identifies a group of patients that really need more study, we need more experimental therapies, and patients who do not benefit from high-dose therapy and stem cell transplant.